And it's time for Wellness. Welcome to this very crucial segment that we call Wellness Extra, rather Wellness Central. And today we turn our attention to a pressing public health issue that has been making headlines across Africa. It's Mpox, a disease that has rapidly spread across various regions of the continent. In an unprecedented move, Nigeria recently received its first ever shipment of Mpox vaccines, a historic delivery that marks a significant step in the fight against this viral outbreak outside of clinical trials.
Now, as we delve into the implications of this development, we are honored to have with us distinguished guests. First off, Dr. Philip Njamanze, Chairman of the International Institute of Advanced Research and Training at Chitikon Medical Center. Dr. Njamanze, thank you very much. You're welcome.
And we also have joining us Dr. Walter Kazadi. He is a representative at WHO, that's World Health Organization. Gentlemen, thank you so much for coming on. We appreciate you for joining us today. Let me start with you, Dr. Walter. What's your stance on the newly acquired vaccines by the Nigerian government?
Thank you very much, and thank you for having me on this program. Nigeria received Mpox vaccine last week. It was actually the first country in Africa to receive Mpox vaccine through a donation through the US government. The vaccine is part of the countermeasures that are used to control the Mpox outbreak that is going on and that has been exacerbated recently. It's a known vaccine. It has been used before for smallpox, and it's also shown efficacy against the Mpox virus. So it has happened, and I know that Nigeria has a strategy to roll out the vaccine. I'm aware that Nigeria is targeting about 5,000 people, including healthcare workers and high-risk population and community, to deploy the vaccine. It's a two-dose vaccine. As you know, it's not yet enough, but it's there. So and I'm glad Nigeria will be showing the way on how to use effectively this vaccine alongside other control measures, including contact tracing, case management, laboratory diagnosis, infection prevention and control, and others. So I just want to emphasize that it's not vaccine alone that will control the Mpox, but it's a combination of all measures. Over.
Okay, that's very interesting. We're going to come back and ask about the details regarding the combination of all these efforts that you spoke about. But Dr. Njamanze is also here with us. Dr. Njamanze, would like to know what your stance is regarding the vaccines acquired by the Nigerian government as well. I think we're still trying to establish proper communication with you, sir. So we'll work on that one. Now, Dr. Kazadi, let me come back to you. Now, could you please give us a present situation of the Mpox virus in Africa currently as it stands? We are aware that it's not yet in Nigeria. It's not in Nigeria, and we're hoping that we don't get it here in Nigeria. But what is the current situation outside of Nigeria?
Okay, thank you. As you know, Mpox outbreak is on since January last year, or in 2022, sorry. It was declared a public health emergency of international concern at some point until the emergency phase was closed in May last year. But it has been reopened because of the recent surge in Central Africa, particularly in the DRC, and the spread to other countries around DRC. The current alert was triggered by the appearance of the new, subtype of the virus. You know, there are variants of the virus called the clade. So far, it was clade 2 that was known that triggered the outbreak, which was called off last year. But this year, the current upsurge it was triggered by appearance of a clade 1b in Eastern DRC, and has quickly spread to other countries in the region. So far, since January 2022, 121 member states have reported Mpox outbreak to WHO in the 6th region, including the African region. But as of July this year, a total of 102,000 laboratory confirmed cases, including 223 deaths, were reported. This was an increase by 8.8% from last year. So in the African region, which is basically sub-Saharan Africa, we have 47 countries. The bulk of these cases are reported in about 12 countries, and they constitute 55% of the global burden. The other 24% is from the Americas, and the rest of the region share the rest of the burden. So, as I said, we've seen an increase in cases, particularly in July, and there are also new countries who have never reported Mpox vaccine, 5 of them, who are also reporting vaccine, and most importantly, declared 1B, that is more virulent as we speak. So we have around 3,500 cases reported so far this year for Mpox, but from January 2022, it's up to a little bit above 5,000 cases. So this is overall the situation of Mpox outside Nigeria. I know Nigeria CDC was already communicated the number of cases that were detected in Nigeria, mostly in the 5 states. But of course, that's to NCDC to give the latest update. But from what we receive from WHO, we understand that Nigeria so far has reported 40 confirmed cases.
Thank you very much, Dr. Kazadi. We have Dr. Njamanze back with us. Now, Dr. Njamanze, I was asking earlier what your stance is regarding the newly acquired vaccine by the Nigerian government. If you will please help tell. Dr. Njamanze, please go ahead.
Hello? Can you hear me? Hello, can you hear me?
Yes.
I can't hear them and they can't hear me. I don't know whether I should try.
All right, I think we still have some work to do when it comes to the connection with Dr. Njamanze. There, we're having some problems. Apologies about
apologies for that. Dr. Kazadi, let me come back to you and ask about this other alternative measures that you talked about earlier on. You said it's a combination of these measures plus a vaccine that will stop the spread of it. I would like for you to speak on the alternative measures that you propose for controlling the spread of Mpox in African countries.
WHO has developed a strategic preparedness and response plan for Mpox, and the strategies are around 5 key pillars. The one is collaborative surveillance, making sure that human surveillance, collaborative veterinary surveillance, environmental surveillance, because as you know, Mpox is a zoonosis, basically, even if it can require the capability to spread between humans. So it's important that countries put in place the collaborative surveillance so that different sectors could provide data that could then be analyzed to monitor the spread of the disease. The second component is the community engagement and empowerment. The communities themselves need to, be aware of the symptoms, how they spread, and how to avoid them. So it's an important component, and we do that through risk communication and community engagement. The third strategy is access to scalable and quality care, and that's why we have case management, which is mostly symptomatic and trying to stabilize the body compartment, but also some of the treatment that are being tried, some antiviral, to see if they may be effective. But I have to emphasize that we are at the stage of trying treatment rather than existing treatment, which is mostly symptomatic. The fourth the component is access to countermeasures, including vaccines, but also other therapeutic that may be under research. All of that need to be, backed on proper emergency coordination to make sure that we have a whole of society, whole of government approach. We collaborate with private sector, the government, NGOs, and others to make sure that there is this, mechanism in place for better accountability and also tracking of the response. So that are the five strategies that are part of the overall preparedness and response plan. And the vaccines are under countermeasures, as I said before. In each of these pillars, you have detailed measures that each country can put in place to control the outbreak. Over.
Now, Dr. Njemanzi, I understand you're back now. Dr. Kazadi just went through the steps in terms of measures to curtail the spread of Mpox. What is your take on vaccines or your stance on Nigeria's acquisition of these vaccines from Spain?
Used to have some vaccines for Mpox, but you have to remember.
Apologies there, Dr. Njemanzi. We cannot hear you, unfortunately. We'll have to make this arrangement at a later time to make sure we get your opinion regarding the vaccines. However, Dr. Kazadi, I'm going to come back to you and back to the vaccine. You've noted the different strains of the new Mpox that we are witnessing in Africa here, Cat 1B especially. And there are plenty of arguments regarding the use of vaccines in different diseases, not just regarding the Mpox. Now, are there any risk factors associated with the use of these vaccines, especially these ones that have been acquired by the Nigerian government? What must we know?
The vaccine that the Nigerian government has acquired is safe. It has been tested, it has been used before for smallpox. The smallpox virus and the Mpox virus are similar. They are part of the same family, the orthopox virus. So because they are from the same family, they do share the same antigen. And that is the rationale for using this particular vaccine for Mpox, irrespective of the clade. So on a proof of concept basis, the vaccine should be effective. It has been tried before and it has also shown to be effective. There is no risk known to the use of this vaccine. But however, as you recall, when the Director General, Dr. Tedros, declared Mpox as a public health emergency of international concern, he also activated the emergency use list. The emergency use list is a mechanism to facilitate, accelerated production of a control measure, in this case, the vaccine. So manufacturers have been contacted to submit dossier to enable the strategic advisory group of experts on vaccine and immunization to give an opinion on the extent to which the vaccine can be used. But at the same time, the vaccine could be used for under compassionate ground to make sure that we avoid unnecessary death that could have been averted by the use of vaccine alongside other control measures. So long as we are aware, the vaccine is safe. It can be used. It was used before in humans. And however, any vaccine, any new vaccine that is being used has to be, for any vaccine that is being used, there has to be some measures to monitor possible side effect that may result from the immunization overall. But that's the monitoring of possible side effect is part of the plan and strategy that NPACDA has put in place to continue to monitor both the effectiveness, deployment, but also potential side effect, which usually happen in very, very slow proportion of vaccination.
Doctor, as we wrap up this conversation, I'm going to use myself as an example. I'm a Nigerian. I'm watching this at home. I've been hearing about monkeypox and Mpox. It's now in 5 states, spreading across Africa. A vaccine is coming. But how can I identify monkeypox? What are the symptoms? And how best can I not get infected by monkeypox whilst I wait for a vaccination?
Yes, monkeypox is it's a disease caused by the virus, the Mpox virus. The way you know that we have Mpox, it comes with generally, after you have been in contact with an infected person, you develop fever, headache, body ache. They are just generic symptoms like malaria, for instance. But then after a few days, you'll see the appearance of skin rash on your face, the body, but also on your arms, etc. So, and this can happen between 3 days, even 21 days, up to 21 days of being in contact with an infected person. So the disease can spread through close, intimate contact, including sexual transmission. It could also spread through what we call the fomite. For instance, if somebody who has Mpox touches the handle or a door, or using the same plate, and another person come and touch that place with, some of the liquid that came up of the lesion from the infected person, you can get infected. So it can spread through intimate contact. It can spread through fomite. It can spread through, sexual transmission, but also it can be transmitted zoonotically from, wild animals in the bush.
So clearly, all we have to do is make sure to wash our hands and stay sanitized as much as possible, and try not to be too close to people. And also ask them, do you have any mysterious rash that you don't know about? Well, Dr. Kazadi, we appreciate you for coming on. Thank you so much for doing this with us today.
Yeah, we apologize that we couldn't have Dr. Njamanzi, but thank you very much, Dr. Kazadi, once again.
It's a pleasure.